Oh my gosh, are you okay? Hey, are you alright? Hey, stay down, don't get up. Are you okay?
Oh my god, I got that on Snapchat. Let me see one Insta story. Oh my god, he's going away. Don't worry, man. I got his number plates.
Okay, just stay right there. I'm gonna call an ambulance, alright?
Hey mate, are you alright? What's your name?
William.
William. Okay, William. Can you tell me what happened?
I got into a rear-ended truck.
You rear-ended a truck. Alright. Can you tell me out of 10 how much pain you're in? 8 out of 10. Jeez. Do you think you can move your arm for me? This arm? Lift it. Okay. How about this arm? Not so much. How about this leg? Can you move any of your legs?
A little bit.
A little bit? Alright, excellent. Well, looks like we'll be taking you to the hospital. Just wait tight, we'll get a stretcher for you. So, how was your Easter break?
It was alright. You?
Yeah, man, that was good.
What'd you get up to?
Just the usual, playing with dead bodies. Okay, so what's the patient like today?
I got into a motorbike accident. You want to see the report?
Nah, I didn't need to see that. Hi, Nurse Wilhelmina. I'm Dr. William, and this is Ian.
Hi, I'm Dr. Ian.
Hello. Hi. So how did you get into this mess? I was riding home from uni, and I got into an accident. Which uni are you from, and what are you studying? I'm a third year anatomy major student at University of New South Wales. Oh, I used to study anatomy as well at UNSW. How did the accident happen? Were you speeding? No. So if you're an anatomy student, then you should be able to tell me about your injuries, right? Yeah. Okay, so Nurse Wilhelmina, could you please pass me the reflex hammer? I'm going to perform the patellar reflex test. William, could you please sit up? Dr. William, didn't you read the patient's summary? You need to inspect this patient's left shoulder region. Haha, I was just testing if you read the report. So, what do you remember about the accident? It was bad. Do you remember which direction you fell on your shoulder? I think it could have been anteriorly? Wait, no. Laterally? Wait, no jokes, superiorly, yeah, hit. So you fell on top of your shoulder? Yes, exactly! Ian, can you go over to the patient and help him raise his arm? Now Ian, can you perform the shoulder dislocation test on William?
Okay, I want you to lift up your arm real slowly.
His auxiliary nerve seems fine. I don't think there's a fracture at his humerus. Oh, got it. Okay, I want you to put your left hand on your right shoulder and try to touch your elbow to your chest.
That hurts. So William, it looks like you may have an acromioclavicular separation.
In simpler terms, he means acromioclavicular joint dislocation.
So in even more simpler terms, your collarbone might have been ripped off your shoulder during your motorbike accident. What? Nurse Wilhelmina, are the X-ray films ready yet? Well, yes, doctor. They're in that folder, actually. Cheers, mate. Can you go turn off the lights for me? Alright, so this here is an X-ray of your left shoulder. As you can see from this X-ray, this is your arm, and this is your rib cage. This here is your clavicle or your collarbone, and that there is your scapula. In some cases, people can dislocate their shoulder right over here, and in your case, you have an acromioclavicular separation here at the AC joint. Now let me show you what a normal shoulder looks like. There you go. This right here is a normal shoulder. So as the name describes, the acromioclavicular joint is found between the acromial end of the clavicle and the acromion of the scapula. And the clavicle is there, and that's the scapula. So this spot here would be your acromioclavicular joint. Although it's technically a plain synovial joint, it functions as a pivot joint, which means that the acromion and therefore the scapula can move forwards and backwards over the end of the clavicle. Ian, could you please turn the light back on? So this here is a model of the shoulder region, and it shows the major ligaments and muscles over here. So this would be the front of the shoulder, and this would be behind. So this bit here would be the AC ligament. So that's your clavicle, and that's your acromion process. So in the space here is the joint capsule, which is thin and loose, and it attaches to the articulating margins of the bones. It also contains an incomplete fibrocartilage disc that separates the joint into two compartments. Although the joint is relatively weak, it has several ligaments that strengthen it. Are you still with me, William? Oh, yes I am. Yes I am. Okay, good. Try and stay awake from me, mate. So the two main ligaments strengthening the AC joint are the acromioclavicular ligament, which is here, and the coracoclavicular ligament, which are these two small ones here. So they both help prevent displacement of the clavicle while the shoulder is moving, and the AC ligament attaches superiorly from the acromion to the clavicle and is strengthened by fibers from the nearby deltoid and trapezoid muscles. The AC ligament mainly resists posterior displacement and helps to strengthen the upper aspect of the joint. However, it is actually the extrinsic coracoclavicular ligament that mainly adds stability to the acromioclavicular joint. Sorry, doctor, the what ligament? The coracoclavicular ligament. It's much stronger and holds the clavicle to the coracoid process. It's actually made up of two ligaments, the conoid ligament and the trapezoid ligament. They're attached from the coracoid process here and go onto the conoid tubercle there, and the trapezoid line, which is under there of this clavicle. Oh, okay. Due to its strength, the coracoclavicular ligament is the most effective at holding the clavicle and scapula in the correct position for articulation at the AC joint. The main movements of the AC joint are a gliding movement, which is like this, as the shoulder joint flexes and extends, in an elevation or depression movement, which is like that, so that it can accommodate movements of the scapula and humerus during arm abduction. The AC joint may be small, but it's actually necessary for proper movement of the arm, and it has an important role in allowing the scapula to continue moving laterally about after 100 degrees of abduction, and the AC joint actually moves 40 to 45 degrees when the shoulder is abducted and elevated. So when the joint is compromised, like yours, you have difficulty fully abducting your arm. Due to the position and relative weakness of the AC ligament, it is quite vulnerable and can be easily injured by direct impact, like how you fell on your shoulder when you were speeding on your bike. But I wasn't speeding, and that's what they all say. Anyways, dislocation of the AC joint can involve rupture or tear of the AC or CC ligaments, or both. Usually a blow to the top of the shoulder will cause the acromion to move downwards, tearing the AC ligament. If the force is large enough, the CC ligament may also be damaged, which leads to a more serious AC joint separation. Right. So in terms of your injury, the position of your acromion is depressed in relation to your clavicle. Looks to me like you have a grade 3 injury, meaning that both your AC and CC ligaments are torn. We'll put ice on the area for now and then place your arm in a sling to immobilize it. Then we'll meet you into surgery to repair the joint. Any questions, William? So after surgery, when can I ride my bike again? Well, you'll need to reduce physical activity involving your arm for the joint to heal properly. So I'd say you're looking at around 4 to 6 weeks, give or take. So what's happening?
Yeah, turn it off on this part. Yeah. Jump and is active, huh? Yeah. Jumping with it. Yeah. Jump and is active, huh? Yeah. Jumping with it. Yeah. Y'all nowadays make me nervous. Got try with the law, they gon' drop all the charges. Y'all nowadays on the causes. Got caught from my dog who's a
You can close the blinds. I don't want anyone to like.
I got juice, and they know I do. Can't lose.
It's pretty cringy, like. It's like you.
It's pretty.
Alright. LELXD. I'm out.
Oh no, but it was up with.
Right. What?
That was unnatural.
Too hot.
Push your arm.